What is up, y'all? Happy weekend. We are still just chugging along in our spooky season here, waiting for this little chicken nugget to make her appearance. I don't know. I think she's coming early. I'm saying it now. I think it's going to be early. She's not technically due until the 16th, but I don't know. I've got vibes. And here's the thing too. Technically, 37 weeks is full term, which if we're looking at cooking chicken, that means it's edible, right? Like maybe it's a little, well, actually, let's go with steak. Maybe it's a little medium rare, but it's edible, right? Anytime after that, and then 40 weeks is like, okay, this chicken or this steak is well done. It's time to take it out of the oven, right? That's 40 weeks, which is still only 3 weeks away. But here's the thing. If she is my daughter, which obviously she is, if she's anything like me, then this girl's like, I'm fully cooked. Why stay in here any longer? Let's go. If it's done, it's done. We out here. So, I don't know. I think she's coming early. But we'll see. Ultimately, obviously, everything's on her time. So, we'll see what she decides to do. If you guys want to make some bets on when you think I'll actually go into labor, feel free to let me know. I'm still manifesting Friday the 13th. Also, one super quick thing I want to throw in here before I get started on this episode. Halloweentown, good lord. So, I'm not going to lie, it's not my favorite Halloween movie. It's not one that I watch every single year. I actually haven't watched it start to finish, fully invested in, years, probably. It's not one of my favorites. But I'm like, you know what? I'm celebrating the long delayed spooky season. Let's add it in. Let's watch Hocus Pocus. Let's watch Coco. Let's watch all these movies we always watch, right? Watching Halloweentown as a soon-to-be parent is such a different vibe from how I remember it before. Because before I watched it and it was like, yep, it's a teenager. She doesn't know she's a witch. And then, surprise, she's a witch. And then they go to Halloweentown and they save the day. And that was the extent of it, right? Watching it now as, like I said, as a soon-to-be parent and as someone that has done I've got a lot of interest in setting, parental boundaries and things like that. Whatever. Been doing a lot of reading on it. And I'm like, oh wow, this is a game changer with this grandma here. Because she literally, 7 minutes into the movie, the mom has such clear boundaries. She said, Mom, do not tell my children about Halloweentown. I will allow you to stay here even though you always disregard what I want. I don't like Halloween. I don't want my kids celebrating Halloween. That's her choice. She doesn't allow her kids to dress up for Halloween and go trick-or-treating. What does the grandma do? Saunters into the house and unloads all of these Halloween decorations, all this Halloween candy, clearly undermining and tiptoeing around her daughter's boundaries with her kids. Which I'm like, okay, that's kind of sucky behavior. It's borderline, whatever. And the mom is about to kick the grandma out, and then she's like, you know what? You never see your grandkids. Let me be a good mom. They love you. You can tell them a bedtime story. Do not tell them about where we came from. Do not tell them about Halloweentown. She made it so clear. She said, I will allow you to have this moment, but do not tell them about Halloweentown. And what does the grandma do? She goes up to the kids' bedrooms when the mom's not there, and she says, let me tell you a bedtime story about Halloweentown. And proceeds to tell them basically everything. These kids are not dumb. They're like, wow, is this place real? This sounds really realistic. And she's like, I don't know. Does it sound realistic? Maybe it is realistic. Clearly egging them on. And then she gives them this book, and it's got a picture basically of Marnie. She's like, wow, doesn't that look so much like you, Marnie? Wow, and she's a witch too. Ha ha ha, what a the coincidence. What if you were a witch? But ha ha ha, just for the sake of the story. But no, actually, doesn't that look like you? Doesn't that put any thoughts into your head? And I'm watching that and I'm like, this piece of shit grandma. Come on, you had one rule to follow in your daughter's house, in her house, and you couldn't even follow that. How easy was it to just follow one rule? And you couldn't do that. And then that's what egged this whole movie plot on, and then that's what led to them running away and going to Halloweentown and getting the mom and the grandma turned into statues, whatever. I'm just saying, I'm like, you know what? That mom is way more forgiving than I would be, because if I set a pretty clear rule about my child and someone just completely disregarded it, family or not, I wouldn't be like, well, okay, it worked out fine in the end, so I guess it's fine. It just, I don't know, it just always grinds my gears when people don't respect other people's decisions. And on that note, let's talk about some healthcare. And when doctors undermine and don't respect their patients' decisions. But I will say, there's some layers to this one, okay? There's some definitive layers of what's okay, what's not okay, where is that blurred line? Are we tiptoeing it? Are we crossing it? So let's get into it. I want to start with the patient-provider dynamic. And specifically in this example, I'm the patient because my doctor kind of pissed me off the other day. And it here's the thing, it still bothers me what she said, and it bothers me more that I'm still so upset about it. This was on Tuesday that I had my appointment, and I'm mad at myself for the fact that it's still lingering in the back of my mind. I can't just seem to shake it. And that's what really annoys me the most, because it shouldn't have bothered me this much, and it shouldn't have stuck with me this much. And it makes me upset that her few poor choices of words and her poor approach at something, at broaching a topic, was able to shake me so much in my self-awareness and my self-consciousness. And that's what really upsets me the most. Even though I've talked through it and I'm like, yes, there's closure. I know the right answer. I know this is what it is in reality. But her dang approach is just still in the back of my head. And that's what bugs me. So I'm at my 36-week follow-up appointment, right? And I've told you guys this. I've gained a thickums amount of weight in this pregnancy. Your girl's big now. I'm in a new weight class, okay? I've never seen this half of the scale before. With that being said, I think it is exactly what my body needed to do in order to raise and create and build a healthy, happy little human. This is the healthiest I've ever felt. This is the best I've ever felt. Yes, I'm a little thickums, but I'm also 9 months pregnant. That's to be expected. I'm going to have a belly. And not that it's all about aesthetics and it's not about what other people say, but no one ever yet has been like, wow, you're getting really big, minus Daniel. But he says it in a nice way. He's like, wow, I'm so proud of you. This was always kind of your goal, honestly. I'm only a little bit past my goal weight. So he'll be like, yeah, dang, you thickums. But it's in a nice way, But otherwise, every other person that has seen me, and like I said, it's not about aesthetics. So this isn't everything, but I do think it's worth noting. Everyone is like, dang, I can't believe you're due in October. I'm still able to squish into Daniel's OCP pants for his uniform. And I don't know how, but I was able to squeeze into my old top for my uniform pre-pregnancy. And it fit and it buttoned up. And yeah, I was at my drill weekend for the reserves and everyone was like, what do you mean you're pregnant and you're due next month? What the heck? You're not even wearing the maternity uniform. You know what I mean? Or everyone and their brother. People at my yoga class, I've been going to yoga every Friday. Super relaxing, 10 out of 10 recommend. And it was only, 2 weekends ago, I think? Someone was finally like, I'm sorry to ask, but are you pregnant? And I was like, yeah, I'm, what would I be at that time? 35 weeks? And they're like, no shot, you're 35 weeks. And I was like, yep, surprise. And they were like, I had no idea, you look so tiny, blah, 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 all this stuff. And so I say all of this, yes, I put on 50 pounds. Yes, I'm breaking 170 right now. Who would have thought? But also, if you look at my frame, I am tall. And I don't feel like I gained too much weight, which is the big thing there. Point blank, I feel good. My blood pressure is good. My blood pressure this whole pregnancy has been fine. And that's the big concern. Why you should be concerned about excessive weight gain in pregnancy, especially if you're putting on pounds quickly, because that's a sign that you have preeclampsia, which is, like high blood pressure with the pregnancy, and that's not good for the baby. It's not good for the baby's heart rate, so on and so forth. Also, if you're eating unhealthy, if you're getting overweight, gaining more weight than necessary for the baby, there are other factors. Like, that's not good for anyone, right? Gestational diabetes, things of that nature. But that's not me. I passed my gestational diabetes test with like flying colors apparently, which I don't know. And like I said, again, point blank, this should be the only statements that matter. I feel healthy. And I look relatively healthy. So that should be it. And pre this appointment with my doctor, I felt fine about it. Like, yes, I was like, wow, this is crazy to see my body change so much. Yes, this is hard to accept sometimes on your emotional days. The fact that you're gaining so much weight and that I am thickums now. I'm not an extra small anymore. I probably will never be an extra small again. And yes, that's kind of hard to accept sometimes because, like I said, I did work so hard to be in good shape and now that's all gone. But I was also like, it's kind of cool what my body is doing. Like, it's kind of cool what my body is able to do. And I was okay with the weight on the scale because I'm like, you know what? I'm looking at girls now, influencers, they're my height and they're, they lift, they're bulky, they're like the weightlifters, but they're not that bulky and they weigh 155, 165. The one girl is 170 and she's like, this is what 170 looks like on my frame. And she is not overweight. She is not extra thick. So yeah, a little bit hard to accept on some days, but I was overall okay with it. I felt content. I was satisfied. Until Tuesday, and I go into my doctor's office. And she weighs me, whatever. And I'm like I said, I'm just over 170. And she comes in, she's doing her checks, she's saying her stuff. And then she goes, so, I do have to talk to you about something. So I have your pre-pregnancy weight as, whatever, like 120, 125. And I was like, yep, that's right. And she's like, well, about your excessive weight gain. And I'm like, the fuck? I'm like, excessive weight gain? I'm like, I don't think it's really that excessive. But she's like, how do you feel about it? And I was like, honestly, I feel fine about it. I'm healthy. I'm the healthiest I've ever been. My blood pressure's fine. I don't have gestational diabetes. And I motioned from my shoulders to my toes. And I looked down at me and I'm like, look at me. I think I'm okay. Like, I don't think I'm not concerned about it. I think my body gained what it needed to gain. I was underweight before and I think it's fine. And she's like, okay. And then I was like, wait, it's kind of a weird reaction. And then I started second guessing it. And then I kind of caught myself over explaining myself. And I'm like, yeah, I don't think I'm that big. Like, yes, that's what the scale says, but that's not really an accurate representation. We all know the BMI index is not accurate. Like, that's not a good representation, whatever. And then she's like, well, yeah. And then she goes, but do you feel like you've gained some extra weight elsewhere? Like, maybe in your thighs? And she looks at my legs and I was like, no, I didn't until you made that statement. And now I'm starting to question it. Like, thank you. Now I do feel like a cow. And she goes, oh, I was a brick house when I was pregnant and, I gained so much weight. And then she left at that. And I was like, okay, are you telling me this because you think I also am a brick house and I'm just not self-aware of it and I think I look fine, but actually I am getting too chunky? And I kind of said, and it got brought up and I'm like, why are you telling me this? Like, what am I missing here? And I was like, are you just saying this because you're legally obligated to chart it because my weight went over a certain benchmark and now it counts as excessive weight gain? Like, is that what you're saying? That you're just not presenting well? And you're not saying hey, I have to legally tell you this, but I think you're fine? And she's like, well, if you're okay with it. And I'm like, what is happening right now? Now, super second guessing it. And it was just a mess. And then that was kind of like the end of the conversation. And I was like, okay, well, I don't really feel like I got awesome closure about this. And then she was measuring my belly, because they do that. And my belly measured right on schedule, like perfectly fine. And it kind of got brought up again. And she's like, I think you'll be okay. I'm like, what do you mean you think I'll be okay? I'm doing 3 weeks, first off. There's not much I can do now. But 2, what the heck? I don't know. It was just, like I said, maybe she just couldn't phrase it the way she wanted. Like I said, because if someone came up to me and they're like, hey, again, I'm obligated to chart this, but just know you are perfectly healthy. You are fine. Don't change a thing. I'm just telling you because I'm a good doctor and I have to chart this because you hit a certain benchmark, but you're perfectly fine. But she didn't say that. She just kind of instilled this secondary doubt, and now I do feel fat, and I'm like, this sucks. I don't enjoy having this feeling. Like, this is not a fun feeling to have about my own self-image. You know what I mean? And then I was like, well, okay, like, let me try and figure out what exactly her angle was. And then I'm like, is she just jealous because she got thickums? And she's like, it's not fair that I could stay small while putting on 50 pounds, but still look small. Like, is she just jealous? And that's why she's like, I was a brick house, blah, blah, blah. Freaking sorry. I've been working out this pregnancy. I've been putting in work. I'm trying my best. I've been trying to eat clean and healthy. I'm sorry if you didn't do that, but don't take it out on me. Don't try and bring my self-image down and my self-worth down because you couldn't take care of yourself in your pregnancy. I don't know. It was just very weird and it upset me. But like I said, honestly, I think it's more upsetting that this was on Tuesday and I'm still annoyed about it. And I still every day, honestly, this week, I've been like, am I too thick? And I had to talk to a bunch of people and I'm like, guys, my doctor said this. Am I getting too fat? Like, would you tell me if I'm getting too fat? It's just, I don't know. I'm like, doctors aren't supposed to do that, right? They're not supposed to make you feel worse about yourself. Yet here we are. So, I don't know. I know that the scale is just a number and I'm trying to remind myself of that. But it is difficult. You guys get it. It's hard. It's hard to see the scale say something that you've just never even remotely been close to seeing in your life. And you're supposed to just be fine with it. And for my dudes out there, if your girl is pregnant, give her some extra love because we are going through it. Like, the amount of body changes and just weird stuff that happens to your body that you just kind of have no idea and it just happens. It's a marathon, okay? It is a mental marathon. And I don't know, maybe this is just me, maybe I speak for all of us, but we can always use some extra love and compliments. There cannot be too many compliments when you're pregnant, I feel like. And the thing that kind of also made me feel a little guilty too, I'm not gonna lie, is after that appointment with my actual assigned doctor, what did I do? 1, I reached out to basically everyone I knew in healthcare and I was like, hey, give me some validation that this is okay. And then 2, I went on social media and I looked at all of these other people that were pregnant, and especially the influencer ones that said hey, I gained this much weight and I did that, and the ones that were working out throughout their pregnancy, again, for validation, I guess. And there's also a few L&D doctors and L&D nurses that are influencers. Some of them I follow, some of them I don't. I just see their content all the time. And I'm reading through some of their stuff, some of their old videos and whatever in the comments to see if I can find any of them talking about weight gain in pregnancy and what's healthy, what's not, and extenuating circumstances, yada, yada, yada. And I was like, why am I on social media right now looking for medical advice when I just left my doctor's office? You know what I mean? I feel like that's not how it should be. But it really is, though, in today's day and age. And let me also preface this very clearly with, I am not anti-healthcare. I'm not anti-modern medicine. If anything, I kind of swing the other way, and I'm sort of against this whole movement right now on social media where everyone is like, don't trust the system and everyone's out to get you in the healthcare realm. Are there flaws in the system? Yes. Do I think the healthcare system in America is perfect? No. Do I think it needs a lot of work? Yes. Do I think that they have ill intentions and they want everyone that walks in their doors to suffer? No. Especially when it comes to pregnancy and stuff. They have this idea that I keep hearing, and they're like, oh, doctors will, they'll lie to you and they'll do all of these things, sabotage your birth plan so that way you have to get a C-section because C-sections are easier for them and it's more expensive. So it's the system and they just want you to spend more. And I'm like, I don't think that is accurate information. And, everyone that's all like, oh, well, we didn't have this back in the day and we didn't do vitamin K shots back in the day and we didn't do erythromycin eye ointment and blah, all of these things, right? And they turned out fine. And I'm like, did they? One, the maternal death rate was a whole lot higher. The baby death rate was sure as shit a lot higher. And I'm like, what did they do? They died, Becky. They died. I don't know. Maybe I'm wrong in thinking this, to each their own, but I don't feel like I'm that special of a person or anyone else that walks in those doors, that they're that special that someone's going to be like, ooh, that's the one. Let's try and sabotage her birth plan and her delivery experience to make it as traumatic as possible, to make it as difficult as possible for her. Let's do an unnecessary C-section. Because it's easier for us. Is it easier? That's a surgery. They have to set up the OR. That's a whole different staff. There's a lot that goes into a C-section. It is a major abdominal surgery. Like, yes, there are complications and risks with natural births, but it's not like a C-section is that much easier. The recovery process is so much longer, and the doctors are obviously a part of that recovery process too. So, I don't think that's really it. And I don't think doctors are getting compensated from insurance companies on whether people have a more expensive procedure or a less expensive procedure. I don't know. I mean, again, what do I know? But that seems a little far-fetched to me. Maybe I'm just going down the rabbit hole of social media right now and lately with this pregnancy, but there's just so many. One, influencers, but then two, just normal people, like people I know, acquaintances, coworkers, stuff like that. And they're all talking like this, and they're all not even just natural birth, unmedicated versus medicated, or home birth versus in a hospital, but just absolutely going rogue. Like, the system is against you and it's all a sham. They're just going rogue, absolutely rogue. And they're getting a lot of this information from social media sources. Yes, there's so much misinformation and half-truths or just general medical information that's just taken as truth for all scenarios, and they're just being pumped out at such a massive rate to the general public. You're just getting flooded with all this information, and everyone is just taking it as fact, and they're using this medical advice instead of listening to their real doctors. And then they kind of get this mentality that because they heard this pretty influencer say, yep, this is what happens, or this is why something happens, they're just kind of taking that as truth. And then they're like, oh, this person knows more than this doctor that's assigned to my healthcare team. And then you get that distrust in your actual prescribing medical team. And then I think that's kind of where the wheels sort of fall off the bus, right? And you just kind of go down that hill. And my big thing that it's like all I think about now every single time I watch any video that says something as a truth. None of these sources are really fact checked. And not to put on my tinfoil hat here, but just think about it. All of the healthcare influencers that you see, and they're saying, oh, do this, do that, this happens, this reaction means that happened in your body, etc., etc. That's just them saying that. That is not your assigned doctor at your assigned hospital or clinic. That is Nurse Judy from Instagram handle RN Baby Girl Lisa 808 crew. You know what I mean? It's that's just their opinion of it. And if they do say like any statistic or these studies say this, blah, 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 again, that doesn't necessarily make it true. Because I know the viewers aren't going into a peer-reviewed journal to then fact-check that this study from this date did in fact say this statistic. You know what I mean? No one's doing that research. They're just watching this 28-second clip with a trending audio and an aesthetically eye-catching caption, and then it's in their head, and then they're like, oh, well, I mean, if this doctor said it, it must be true. And lastly, probably the most psycho tinfoil hat comment, but here's my thing. Unless their doctoral degree is framed in the backdrop of their video, like, just because they're wearing scrubs doesn't actually mean they're licensed providers. Maybe they went through some med school and they flunked out. Maybe they were a provider, or maybe they were a nurse practitioner and then they lost their license for who knows what reason, but they forgot to pass that on to their following. You know what I mean? I'm like, we don't really necessarily know for certain that these people are actually licensed providers or whatever they say they are. Now, granted, I know that's going way down the conspiracy theory rabbit hole, but I'm just saying, like, it's kind of the wild, wild west out there. And there's not really anyone to fact check it, you know? And I will say, I have seen some people that are really good with giving advice. You know, they're an L&D nurse or whatever, and they'll say, hey, in my experience, I've seen this breathing technique work. Or from what I've seen, here's what I would personally pack in my hospital bag. Or even better, hey, this study just came out showing this evidence on something. And in the caption, they'll actually list the DOI index number, which for all of you normal people out there, that's the digital object identifier. It's like the social security number, but for publications. It's specifically assigned to that article or publication. And no matter where it's published, no matter what journal it's in, the DOI won't change. So it's very easily found for backtracking and for referencing for other citations. And again, I will say there are some good people out there that are healthcare professionals that are giving evidence-based good advice and good information. I'm not just bashing all of them, and I don't think we should get rid of all healthcare professionals on social media, because if that's their outlet, if they want to share that with the world, I think that's a good thing. So let's get into that side of things. People are getting fired kind of left and right and losing their licenses over social media, especially in these last, 3, 4, 5 years. It's been going pretty crazy. So I looked into that. I started doing some digging, and it goes back, like I said, 2018, 2019, but I feel like it's definitely surging now in these past couple of years. And so I found an article from Forbes that was published in December of 2022, and they cover a ton of different examples and scenarios of healthcare professionals just towing the line with social media. So there's this one licensed nurse practitioner, and I think she specialized in dermatology, yeah. And she became an influencer 3 years ago. And at first she was just posting about anti-aging advice, skincare products, routines, basic stuff, And then she built up a pretty solid following of 92,000 people. And even though she was a board certified nurse practitioner, and they are allowed generally to prescribe medications, diagnose conditions, and offer counseling to patients, that's the big keyword there. This girl, her last name was Padilla. In some of her videos, she was urging viewers to consult a dermatology provider, quote, to make a safe, educated decision or understand the risks of stronger treatments. Which is a good thing, right? So even though she's legally allowed to counsel patients, she was saying in her videos, hey, make a safe decision, yada yada. And none of her videos disclosed information about patients, which is the big thing for medical privacy laws with HIPAA and all that. And then she's really ramping up her content, right? She started monetizing her content. And one TikTok video, it was promoting some beauty product. I don't know the brand. I'm not familiar with it. But it brought in the equivalent of 2 weeks' pay on her day job. So Side note, I think that's also kind of part of the problem. We don't pay our healthcare workers enough. I don't think we do. The fact that one TikTok video makes 2 weeks of her pay and she's a nurse practitioner, that's pretty insane. So things are ramping up, right? But then apparently Padilla crossed a line, an unspoken line, when she began offering virtual consultations, which again, she is legally authorized to do as a nurse practitioner. But yeah, she used virtual consultations, and she announced plans in the fall to launch a skincare expert course that would teach other healthcare providers and skincare enthusiasts about acne routines and what she referred to as the frameworks to treat patients in dermatology. And she was fired soon after for a breach of contract. Her employer viewed the course and consultations as a way of competing with and harming the practice and hurting the field more broadly by sidestepping having to refer to dermatologists altogether. And Padilla claims that she kept her boss apprised of her plans in advance. So, I don't know, man. It's kind of debatable there. Like, I don't know that you can fire someone because they're doing a better job than you, because they're bringing in more patients than you are. I don't know that that's really grounds for firing. Also, the bigger thing here, which I've got a few more scenarios I'll tell y'all about in a second, is when was it explained to her, in what contract, where in the contract did it say you can't do this on social media? And I think that's where that gray line is. So let's look at some more, because like I said, there's a whole bunch of them. According to this Forbes article, 1 in 5 Americans seek help with a health issue by turning to TikTok and Instagram, YouTube, Twitter, Facebook, etc. for advice before approaching their doctor. That's wild. And the same study said that nearly the same number trusted health influencers more than medical professionals in their community. That's saying a lot, I feel like. There's this nonprofit association for healthcare social media, and it was formed in 2019 to help the medical community responsibly use these platforms as educational tools. And Google-owned YouTube, the most lucrative social platform for creators, is actively encouraging licensed doctors and nurses to share their expertise online. They actually just launched a program recently to label and boost medical creators' videos in search and discovery. Previously, only academic institutions, public health departments, government groups, and hospitals were eligible. And so Dr. Garth Graham, he's a practicing cardiologist. He's also the director and global head of healthcare for Google and YouTube. He told Forbes in this article, quote, "People are going to be going online and looking for information, and they're going to be acting on the information they see. Having a presence, as long as it is evidence-based, accurate information, is valuable. It's valuable at scale, and it allows an opportunity for people to get access to information that they may not have had before," unquote. And I actually really love and support that aspect of this, because according to the CDC, published August 3rd, 2023, the overall number of Americans without health insurance dropped to 7.7%, or 25.3 million Americans in the first 3 months of 2023. So that is a huge demographic of people that do need help and assistance, and they just can't get it from the healthcare system. And so if they can get some healthcare advice from social media, which they do have access to, is that the worst thing in the world? I don't think so. Because even the people that do have health insurance, that doesn't mean that they can always afford to go to the doctor every single time they're sick or every single time they think something is wrong. You know what I mean? But like I said, I think the big issue here with these blurred lines is there's no clarity on what's okay and what's maybe debatable on social media. And in some cases, yeah, it's easy to see. Like, okay, this is grounds for firing someone. Like, I found a bunch of examples on that too. So there was a group of Emory healthcare nurses that all lost their jobs back in December of 2022 over a TikTok video they made making fun of labor and delivery patients. There was a chair of Columbia's Department of Psychiatry who was suspended, which is insane. They should have fired his ass because he made this super racist and sexist tweet. There was a Texas dental practice that was fined $10,000 by the U.S. government for HIPAA violations on Yelp. There's nursing home workers who were fired for posting explicit photos of seniors on Snapchat, Facebook, and Instagram. Yada, 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 right? So when it's things like that, if it's pictures of non-consenting patients, if it's any sort of HIPAA violation, stuff like that, yes, that makes sense. Fire their asses. However, where it gets kind of fuzzy, especially now, is because social media policies apparently in a lot of healthcare settings are very vague, they're inconsistent, and especially they're outdated. And so workers, employers, they're all just like, they don't actually know what's okay, what's not okay. They're just kind of here. You know what I mean? And platforms are always changing the rules for healthcare content just to kind of fight the whole misinformation and disinformation, especially with all the vaccine stuff and the COVID stuff and all that. So there's a bunch of groups established now, like the American Medical Association, the American Nurses Association, along with medical schools, publications like the HIPAA Journal, and they offer broad social media guidelines that emphasize the importance of, again, upholding patient privacy, maintaining professional boundaries with those receiving care. But they don't get any more specific than that. They stop just short of, addressing potential conflicts of interest or competitive issues, best practices for those partnering with brands or monetizing their posts, or how social media policies should be enforced. And so again, that Dr. Graham from YouTube, like I said, he believes physician creators should have the opportunity to be paid for their content. What he said in the article was, quote, as they are financially rewarded in other aspects of their professional career, their time spent here is equally valuable, unquote. And so, yeah, you have those never events, like you should never do this, like never post private HIPAA information, yada, yada, yada. But there was a professor of bioethics and health policy at Loyola University, Chicago, and she published some research on ethical issues with social media in healthcare. And she says, I don't get the sense that there's really stringent rules out there with regards to people's social media use. It doesn't get down to the granular level of what is appropriate, what's not appropriate. And she said, so many policies just kind of collect dust in a binder somewhere and don't get updated. And then if you are thinking about individual practices, they don't really have the bandwidth to be updating a policy and procedure manual, unquote. There was one recent nursing school graduate, and he, from this Forbes article from 2022, and he said that it was drilled into the curriculum from pretty much day one to not post photos or anything related to his role as a nurse on social media. He said that while he understands and agrees with the need to protect patients' privacy, he was, quote, disheartened by educators' broader approach to the technology. He goes on to say, quote, this archaic mentality of healthcare workers not being able to express themselves or live their lives outside of their role as healthcare workers can sometimes feel a little bit dehumanizing and also just not very empowering, especially when our jobs are so stressful and hard as it is, unquote. He added that nearly everyone in his orbit knows a nurse or someone else who knows a nurse that has been let go in their role or had some sort of repercussions for posting on social media. So a lot of these stories find their way to Katie Duke, apparently. She is a longtime nurse and advocate for medical creators. She's got 142,000 followers on Instagram. Apparently that's an important piece of information that Forbes wants you to know. And so she was an early healthcare influencer who began building her online audience a decade ago. And she was fired in 2013 for sharing an Instagram photo of an empty trauma room at New York Presbyterian Cornell, where she was an ER nurse. And I saw the picture, and it's literally just a picture of a messy OR room, like after a surgery. And that's it. There's no patient records. There's no like info still on a screen. You can't even see the Pyxis, like nothing. And so at the time, she went on some ABC docuseries, New York Med, which showed what goes on behind hospital doors. And as a part of that, she was encouraged to post about life on the job, according to her. When she reposted the photo of the messy aftermath of a, quote, miraculous case that a chief resident had already shared on his own Instagram, she ran into trouble with higher-ups who viewed it as insensitive. She was fired shortly after by her then manager, who she said told her, quote, "You'll never be famous like Dr. Oz. You're just a nurse. No one cares about you using your voice on social media. Social media will get you nowhere. I want nurses here who are just going to come here, be a nurse, and go home. You're trying to do too much," unquote. That's wild. First off, the fact that the chief resident, who also already posted the picture, if he wasn't talked to, if he wasn't reprimanded, if he wasn't fired, that's trash. And then for her manager to tell her like, oh, just be a nurse and go home and then stop being a nurse is insane. The whole "you're doing too much," yikes. But also that phrase will always trigger me. But anyway, so New York Presbyterian did not respond to a request for comment about Duke's termination and the hospital's approach to workers' use of social media. Duke said she realized in retrospect how the post could be upsetting to the patient, who is not pictured. I don't know that I would really see that. She said she did learn a lesson from it, but did I need to be fired for that? A competent, leading, compassionate nurse with so many years of experience who is loved and respected by people on the unit, unquote. So, yeah, and apparently even today she still gets messages every week from nurses all across the country who are being fired for posting in social media situations. And she just said the mistake doesn't match the punishment. One nurse she said she heard from recently was fired for posting a photo celebrating a colleague's last day at the hospital. It was taken in a nondescript hallway, but the name of the facility was visible, which I don't really understand how that would even be an issue. Like, where is if you know what hospital she works in, is that not, I don't know. I don't understand it. Like what I want to see the contract that she signed and what policy that hospital has that says our staff cannot announce to their world, their friends, their family of what hospital they work at. That's insane. I don't understand it. Another nurse posted on her private Facebook about a tough day in her short-staffed unit, simply hoping for some support, and she was fired for speaking negatively about the hospital on a public forum. That one's kind of crazy too, because again, I'm like, all right, well, if you're short-staffed, if you're that short-staffed where it becomes a health risk to your patients and a concern, shouldn't that be a red flag for the leadership? Shouldn't that be a red flag for the management team to say, maybe we should do something about this? If anything, aren't there laws protecting whistleblowers from doing things like that? No? Maybe? Like, where are the lawyers in these situations? And so, another quote from Duke, from this article in Forbes: "Hospitals and healthcare employers aren't exactly using these as opportunities to grow and learn together. They're just saying, you posted this on social media, it went viral, cancel culture, people are calling for your heads, we're just going to fire you." And they're firing nurses who are taking good care of patients in an environment where, like Duke said, they're already so strapped for safe staffing. It's sad and it's really frustrating, unquote. And Dr. Graham, the cardiologist who runs YouTube's health arm, he added as well that elevating qualified medical creators is key to pre-bunking and debunking misinformation for patients. Who else to get information early in their journey than from a licensed, qualified clinician who knows the topic? We're only in the early stages of figuring out how these fast-evolving technology platforms can be used effectively in the healthcare ecosystem, but gone are the days when patients would wait until their next office visit to ask their doctor a question. Looking up health information online is now a regular part of their journey, so we have to be where consumers and patients are. not being in there creates a void. Doctors get into this field to have impact, and beyond the one-to-one patient relationship, many physicians now want to reach more people at scale. And Graham says this is a good thing, unquote. And I agree with him. I think in that sense, in that perspective, it is a good thing. As always, we're going to have that battle of, okay, where's the line between censorship? Who's to say this person's opinion is better or less qualified than the other person's opinion? Because healthcare, to a certain extent, is kind of personal. You know what I mean? Like, it's not every treatment plan will work for every patient. And so if you are, I don't want to say mass producing medical information, but if you are presenting this information, even if it is evidence-based on such a large scale, by default, your audience will kind of take it as like this is for me, this is meant for me, this is my treatment plan, so this will work for me because he's a licensed provider. And that might just not be the case. I mean, I think that's a kind of tricky thing, and censorship is always, I think, going to be a messy, tricky thing, but we can't avoid it in this day and age. We can't have social media and then fight the battle of censorship, or say that we don't have to fight the battle of censorship. It's just, I don't know, like I said, it's a wild, wild west out here. So, but yeah, it is tough. It's a tough world to navigate because you want to get the best information, but for any of us that kind of overthink things, it is difficult to know, like, okay, is this trustworthy information? Is this not trustworthy information? Do I trust my doctor? Do I trust this other doctor that I see on social media that said the complete opposite thing? You know, it's fuzzy. It's just fuzzy all around. I do think it's absolute trash, though, that some of these people got fired for literally no reason. Well, not that there's no reason, but not a good reason. Like they said, the punishment just does not match the behavior. So, and if they're firing the nurses, but not the chief residents that did the exact same thing, that's also trash, I think. So, yeah, that's my take. Hopefully you guys enjoyed this episode. I know it was a little healthcare heavy, but we all need healthcare at some point, right? So hopefully it's not too far out of the wheelhouse for some of y'all. Also, I have decided that for my podcast benchmark, once we hit 500 plays, I will get you guys some cool stickers, and you can put them on your water bottles, put them on your snowboards, put them wherever you want to put them in your kitchen drawer. If you're like me, where you're always like, oh, but I don't want to waste this awesome sticker on something, and then what if it comes off and then I lose that sticker? I'm so bad about that. But yeah, do with it what you will, and check out some of my older episodes if you haven't listened to them yet. Let's get those plays up. We'll bump it up to 500, and I will catch y'all next time. Have a good week. Make good choices. Take care of each other. Be a decent human being. Take care of your health. Take care of any healthcare workers that you know, because they also need some love and support right now. And yeah, that is it for me. Okay, bye.